Hello, today I'm going to show you how to set up for a crown or bridge prep. It's very similar to how to set up for a filling procedure. So if you haven't watched that yet, I recommend going back and watching all of that. Kind of prepares you on how to basically set up a restorative treatment within the room. Once you've finished watching that, come back to this video and then we can kind of proceed forward. Moving forward. So make sure we're double checking the treatment, make sure everything aligns perfectly within the chart. You can also look on the front of the route slip and make sure that they correspond with each other. Double check the schedule as well and make sure everything is corresponding with each other. I put a filter on myself for HIPAA protection here. Also should mention that you should always double check with your patient the treatment that we are doing for that day. Make sure that they fully understand what we are doing before proceeding. Alright, so now we're ready to gather our supplies. I've made it easier by compiling a list that you can screenshot or write down as needed. This is everything that you need from sterilization, which includes the restorative tray, handpieces, articulating paper, crown preppers, and the magnetic block. You can find your restorative trays up in the cupboard, depending on which office you're at. And this is kind of what a restorative tray looks like. It's kind of wrapped up, so I'll show you some different examples. In Hilliard, our restorative tray looks green versus the root canal tray, which is a deep blue color. In Westerville, our restorative tray is more of a bluish greenish color versus the root canal tray, which is a gray color. So we'll grab the bluish greenish restorative tray as well as our hand pieces. Grab some articulating paper. Normally we only grab one, but for this particular case I'm going to grab two. And now we're ready to set up our room. I have also compiled a list of things that you need within the room. A lot which are similar to what you would need to set up a filling. The only thing that's really differing is you need impression tray, Penatip cord, core buildup material, temp guns, and stuff for a temp. So we'll get into that here in a second. This part is pretty self-explanatory, just laying things out where they should go. Tray paper to the side, articulating paper on the assistant side, putting the tray paper on the extended tray, as well as the hand pieces. Also placing the suction tips on the actual suctions on the assistant side. Like I said, pretty self-explanatory. And I will get into the actual setup. A lot of the crown prep supplies will be in the second drawer down. In Westerville, you can find most of your stuff that you need for it here. You'll get out stuff similar to a filling. This includes a Sure-Fill gun with Sure-Fill bond, a bond well. Again, the bond well looks like this, and the bond can come in either a single use, just like this, or it will come in a two-step kind of container. So just be on the lookout for that. Light covers, and we use our curing lights in every single restorative setup. So we'll grab a couple of those. Next we'll get into some of the extra stuff. For example, Viscostat, which is like a gelatinous kind of product. It stops heme or blood. It'll look clear or stiff. It'll have the yellow brush tip on the very end. Next we have our edge. So this is what the assistant side will kind of look like. Starting in the upper left-hand corner, we have cord, which comes in 4 different sizes. We have the shade guide to the right of that. And underneath the cord, we have all the stuff that you would need for a filling. Underneath the shade guide, we have the Sure-Fill gun. To the left of the Sure-Fill gun, we have the core buildup material, which is absolutely needed in any crown prep or any bridge prep procedure. We also have the Viscostat. We have the impression tray at the very bottom, which we'll use for the temporary material at the very end. And last but not least, we also have our sunglasses. This is very important for any procedure that we do, so make sure to always have that. Shifting our focus over to the dock side, we have everything we need to make a temporary, which includes the temporary material inside of the temporary gun. As well, below that, we have our temporary cement, which is coming in a 2-step process in this case, as well as a mixing pad. And underneath all that is the anesthetic. So like I said, in that example, there is a 2-step. We also have the syringe it can come in. The temporary material you can find in the bottom drawer, and most of the time it will come in the shade A2, unless it's for aesthetic cases. In that case, it would be either A1 or B1. So just pay attention to that. Again, this is for a complex setup. Last thing we'll need for any setup is anesthetic. And again, I have compiled a list of what you will need. So topical, cotton tip applicators, 2x2s, and then the needles and actual anesthetic carpules. Starting at the upper left, we have our extra short needles, which are used for infiltrating or for upper anterior fillings. And then we have our long needles, which are typically yellow. We use those when doing mandible blocks, or we're doing a lot of fillings on the bottom. So just remember lower, long. And then we have the short needles, which are on the bottom, which are used for everything else. We can use them for infiltrating. We can also use them for incisal blocks. It just depends on the situation. And then we actually have our anesthetic carpules to the right, top to bottom, septo, carbo, lido. Lido's red, carbo is beige, and then septo is gold. And they can be kind of hard to differentiate, so just really take a good look at them. And for this case, I'm going to get out at least one of each, and then your setup is done. Don't forget your sunglasses to protect your patient's eyes and everything. And as always, if you have any questions, please let me or one of your team members know. We would be happy to help you get acclimated into everything. I know that sometimes this can be a lot of information. And as always, have a good day.